We do find that the commonest age at which breast cancer is detected in India is around 47 years. Most women think that cancer is a disease of old age. The incidence of genetics being one of the causes is much higher. So if you have a male breast cancer only in the family, be prepared that even the women probably would be at risk. Because the lifestyle has moved towards westernization, a lot of other factors have come in, you find that the breast cancer is actually doubled. 1 in 28 women in the urban area would develop a breast cancer in their lifetime, as compared to in rural areas where you get 1 in 64 in their lifetime.
Let's say someone has the cancer. Are they better off if they have the HER2 or the triple negative?
I would say a HER2 probably, because the HER2 cancers have this well-researched targeted treatment. Lumps don't lie. So if you have a lump and it's painless, you must investigate for breast cancer. So one of the risk factors is nulliparous, that means never had a child, never breastfed. So these two factors really play a very important role. A late menopause is a risk for breast cancer.
Does this kind of carb heavy diet also lead to greater risk of cancer?
All of these high carb diets and poor carbs that are taken in increase the risk of obesity.
Yeah.
It is obesity that causes higher risk for breast cancer.
Can a better and healthier lifestyle prevent you from getting breast cancer even if you are genetically predisposed to it? And is early detection the key to survival? These are very commonly asked questions. And because it is Breast Cancer Awareness Month, our guest on Buzz by the Bay is the head of Breast Oncosurgery from the Krishna Institute of Medical Sciences in Maharashtra, Dr. Vani Parmar, who is also a board member of the Women's Cancer Initiative at the Tata Memorial Hospital. Welcome on the show, Doctor.
Thank you very much.
You have extensive experience over 35 years. You also taught. Breast cancer may not be the most pleasant topic, but it's a very important topic because, one has to create more and more awareness. Because from what I read, its early detection is really key. And I think 60% of the people in India detected at a much later stage. Is that so?
Absolutely. You're spot on. Also, October being the Breast Cancer Awareness Month, we need to be talking about breast cancer much more. And awareness is actually the key, especially in a country like India. Early detection does help us to have excellent outcomes, smaller tumors being detected, and obviously the outcomes are going to be much better, not just for improving the surgical extent for the patient, as well as for the overall survival as well as the outcomes.
If you can tell us from your experience, what is the current trend? What is the most alarming trend that you are seeing in recent years in India where breast cancer is concerned?
So India is a very young population. Demographic wise, if you see, nearly about 70% of our women are below 50 years of age. Now, keeping that in mind, we do find that the commonest age at which breast cancer is detected in India is around 47 years. So obviously with the younger age, there are a lot more social issues. There are a lot more things that are different as compared to an older woman breast cancer. And that's where I think awareness needs to come up, because most women think that cancer is a disease of old age. It really is not, because there are certain things that really we have to be alert and aware of.
So that is the alarming trend, that you're seeing it in women who are around 47 being the median age. And yes, I have read that statistic. And it is expected that around 16% of women diagnosed will be younger than 50. Is it true? Is that
I think I'll correct that, because when they say a median age, 50% of women will be below 47 years of age.
Below 47?
Yes, so below 35 is what we know as 16%. So these are the very young women breast cancers.
Below 35?
Below 35.
Do you have many patients who are below?
I do. So a lot more younger women, and also because awareness has come up now, they do come up much earlier and they present. My youngest patient, as I remember, was a 19-year-old.
19?
Yes.
So
And it could-
sad.
Absolutely. I mean, you wouldn't think that a 19-year-old could have breast cancer, but there is an important thing underlying why do you find younger women with breast cancer? In fact, genetics is one of the most important cause of finding cancers in young women.
I want to talk about that, lifestyle and genetics. Can a better lifestyle, prevent you or help you avert it or improve your survival chances, even if you are genetically predisposed to it?
Yes, in fact, to be very frank, overall, if you look at the breast cancer incidence, genetics plays a very small role. It's only about 7% of women will have some kind of a genetic mutation that's been carried down in the germline mutation. That means carried down from mother, grandmother, grandaunt, aunt. So the maternal line is really given the importance. But I would say that it's not just the maternal line. It's also the paternal, because 50% of the genes are shared from the paternal side. So genetics do play a role in breast cancer in young women. In younger women, you find a higher percentage, nearly 20% of them would probably carry genetic mutations as compared to that. In fact, male breast cancers, which is also another aspect that we don't normally discuss, have a higher incidence of genetic mutations.
Very interesting, very fascinating statistics.
And the interesting bit in breast cancer, it's not just the mutations. Lifestyle plays a very important major role in increasing the risk for breast cancer. There's no single causative agent. And when you have a mix of all of these, there's a genetic risk and there's also a lifestyle that is not suitable, there would be definitely a higher incidence of breast cancer that you would see.
Okay, so some very interesting statistics you've given. You've said in the younger population, younger demographic is usually the genetic cause that is causing it. Of course, lifestyle plays an important role, but you're saying in men, largely it's genetic factors that are causing the
It's
the
much
breast
higher.
cancer. It's
So
much
when I
higher.
say largely, I wouldn't say all of them. I would say that it is. So quite a bit of the risk factors, especially the lifestyle factors, do affect men as well as women. But the incidence of genetics being one of the causes is much higher. So if you have a male breast cancer only in the family, be prepared that even the women probably would be at risk.
Really?
Yes.
Oh my God. And what is the ratio? Are you seeing a lot more male breast cancer now in India?
No, that's been more or less stable. We see
Okay.
1 in 100 breast cancer patients would be a male.
Okay.
But what's interesting is the syndromes, that you do find other cancers associated with breast cancer. So you may have a male with a prostate cancer, you may have a gastric cancer, a thyroid cancer, and when you have a history of these in other members of the family and you have somebody presenting with a small tumor, there is a high probability that may be actually breast cancer. So they occur in syndromes, in groups.
Okay. So it's 1 in 100 breast cancer patients is male, is what you're saying. That is the statistic. But going back to this 19-year-old young lady, I mean, did she survive the breast cancer?
Oh yes, she did. She did survive and she's actually gone ahead to get treated. She's recovered from the cancer. She's even got married. She has 2 children. So you see, everything is possible. If an early detection, it can be treated well, and if treated appropriately, they can actually carry on with a normal life.
Did she have to have surgery and
She
then
did.
chemo?
She did.
Radiation?
So she received chemotherapy, she underwent a surgery, she had radiation, she went on to hormone therapy.
Can you give us some statistics for India for breast cancer?
So India breast cancer has been rising up. In fact, we were seeing literally a 12 to 14,000 per year increase in the new cases that we get diagnosed. So in 2023, we had 1,27,000 cases, and I think now in 2025 we have nearly about 1,32,000 cases, new cancer cases that are being diagnosed. In fact, there has been a previous, I would say, a decade to maybe 12, 15 years back, cervical cancer used to be the predominant cancer in women. With increasing improved hygiene, in fact, cervical cancer incidence has come down. Because hygiene plays a very important role in cervical cancer.
Yeah.
There's no such thing in breast cancer. In breast cancer, because the lifestyle has moved towards westernization, a lot of other factors have come in, you find that the breast cancer is actually doubled from the cervical cancer incidence. So the predominant cancer in women in India as well as globally is breast cancer.
Breast cancer, because it is more lifestyle dominated cancer.
Absolutely.
That's why. And you're saying in India, because a move towards a more westernized lifestyle, could that be in terms of your diet? Foods with preservatives?
So I would say it's not just the diet. If you look at even the age at marriage, that is going up. Women want to be out and working, and they're not looking at early, family being completed. So they don't want to have children early. And when they delay pregnancy beyond the age of 30 years, you're also increasing your risk. In fact, there's been a study which looked at women married at the age of 19, and which is what you see in rural areas.
Yes.
They marry much earlier. That 19 years age of marriage actually brings down the incidence by 1/6. So it's a significant drop in the risk of breast cancer in women who marry early, have children early, breastfeed at least for a period of 6 months, a max of 1 year. You see the incidence comes down significantly.
So that's why we're seeing the rural-urban divide in India, right? We're seeing less instances in rural areas. But then survival rate, wouldn't the survival rate be higher in urban areas even if incidents are more?
Well, that would be a kind of a take home from the fact that you do find better services, healthcare services, easily accessible in the urban areas.
Yeah.
But if you look at the incidence in rural area, and I would say the majority population, as of the last statistics from India, 64% of women, Indian women are in the rural areas. We are actually in the urban area, the smaller percentage.
Yeah.
But what's important is there is lack of awareness in rural areas.
Yeah.
So they present at a later stage. Incidence wise, we are actually in the urban area much higher. 1 in 28 women in the urban area would develop a breast cancer in their lifetime, as compared to in rural areas where you get 1 in 64 in their lifetime. If you look at the incidence below the age of 50, we are like 1/3 the incidence in the West,
Yeah.
and 1/4 in above 50. So we are in fact not there yet, but it's a threat. It's a threat.
Let's say somebody cannot marry at 19 or have children early. There's got to be other lifestyle changes you can make to reduce the risk of breast cancer. But if you could first, before getting into that, can you give us some idea of the survival rate in India?
So in the numbers that we are seeing currently, early breast cancers account about 40 to 50%. And that when I say early breast cancers, these are really not, they're loco-regional, loco-regional, that means it has not really advanced even in the breast itself, and very few of them would have reached the axilla or the armpit, which is where the breast cancer cells first reach.
Yeah.
The next stage is the locally advanced, when they become very large, their women has not presented on time, and you have a large disease which cannot be operated on upfront. And these are ones who would definitely need chemotherapy. Such conditions are seen in about nearly 50 to 60% of women. And then the third that we talk about is the really advanced, that's gone beyond the breast and is now not curable, and these are the metastatic breast cancers. They account for 10%, and that number has never changed. Irrespective of screening, irrespective of early detection, that 10% seems to be constant. What we can make a difference is in the rest of it. We are looking at operables and the locally advanced. If you can detect a cancer very early, very small, say a 1 centimeter tumor, small palpable disease, and women can detect themselves by breast self-examination. Such tumors, you can have a very excellent outcome of nearly 95 to 96% survival. Whereas the minute they get locally advanced or they're advanced, it starts falling down to 40-50% survival, and then when they're metastatic, it's just a sheer 5%.
What about screening and mammograms? At what age should a woman start doing that?
So screening, let me come first to the fact that in India, we don't have a national screening program. It exists in the West.
Okay.
But that's also multifactorial why we don't have it. As I've told you, in the national figures, our numbers don't really go to a significant number. Overall mortality due to cancer is 10% of all cancers.
Okay.
With breast cancer being the cause. So it's not a major problem in India, but yes, for a woman it is an important thing because we need to have treatment that makes better impacts. So as far as screening is concerned, I would say that at the age of 20, one should be aware, get self-aware, start practicing breast self-examination.
Okay.
It's a young age. Never think that young age is something that you will never see a cancer in. At the age of 30, breast self-examination definitely, and add to that a clinical breast examination.
Okay.
That means have a doctor affirm to you exactly what you are seeing is the right thing. A lot of changes in the breast actually evolve from 20 to 30. When you reach the age of 40 is where you add in a mammogram.
Yeah.
Because any time before that, mammograms don't detect cancers in the breast. They're very dense, very active breasts, glandular, so the mammograms are not able to pick up. And beyond the age of 50, having a mammogram every 2 years is a good idea, because that would help you to detect the cancer early.
Okay, so beyond 50, every 2 years you must have a mammogram.
Right. So I would add to that, ICMR has brought out a rule, saying a guideline, saying that at the age of 40 you have an annual mammogram. There is no evidence to strongly support this, but the basis probably is because, as I've told you, the age at which you commonly find is that 40 to 50 years of age
Yes,
in India. So probably you don't want to detect them late. Younger age cancers are bad cancers. They're aggressive, they're larger, and you miss them between screens.
Yeah, so younger age cancers are more aggressive. They spread faster.
Yes.
So, but when you're older, I mean, it just spreads more slowly in the body. Is that how it works with cancer?
Well, I would say the biology of the cancer, and that's where you come in into types of breast cancers.
Yeah.
That differs between the young age and old age.
Okay.
And this divide of the cancers being good or bad is based upon certain types of cancers. Okay. So there are the good cancers, hormone responsive, which are known as the ER, PR positive. They express receptors.
Okay.
So these are treated with tablets, less need for a chemotherapy. I wouldn't say that young age will get away without chemotherapy. Most of them would require it, but there is a good behavior cancer. Okay. Second type is the triple negative cancer. They don't express any receptors, and these are bad biology cancers. They occur more in the younger women, and then the extreme age, beyond the age of 75.
Yeah.
So they are seen in both extremes, young women as well as very old women. The third type is a HER2 positive, again a very aggressive cancer, and these require specific treatment called as targeted treatments.
Immunotherapy?
Well, immunotherapy applies to the triple negative breast cancer.
Triple negative is where you use immunotherapy.
Yes, yes.
If you could just elaborate on that a bit, what exactly is immunotherapy? Is it done in conjunction with chemotherapy?
Absolutely. So currently the use of immunotherapy is basically been researched and proven to have benefit in the triple negative young women breast cancers. And here we give them before we start, before we offer them surgery. In fact, it's given right in the upfront setting. Chemotherapy along with immunotherapy seems to be having a great impact in improving survival.
Okay.
But
this is for the triple negative cancer.
Triple negative breast cancers, and based on certain expression of certain factors, but these factors are more important when you give them after surgery. But in triple negative breast cancers, currently the standard of care is to give them chemotherapy along with immunotherapy, and it gives excellent response. The tumor shrinks down, and we are able to do less extensive surgery. The outcomes are also better.
Okay, so triple negative, you give immunotherapy, chemotherapy first, shrink the tumor, then do the surgery.
Absolutely.
For HER2 positive breast cancer, what do you do?
So in HER2 positive breast cancers, again, we start with a systemic treatment. And when I say systemic, it means chemotherapy along with targeted therapy. So it's a combination of chemo with targeted.
Yeah.
And this targeted acts on the HER2 receptor.
What does HER2 mean? It's a receptor.
It's a receptor. It's actually every tumor is checked for expression of receptors. So when we get a diagnosis or a biopsy done, there are two parts to it. One is it a cancer?
Yeah.
Once you confirm it is a cancer, the second part is actually the important one, which
Yeah.
tells you the behavior and what treatment works on the cancer, which is the immunohistochemistry part.
Okay.
That is where you get the HER2 receptor, and it's a cell surface receptor. The cancer cell expresses the receptor on the surface. And if you have the receptor, you know the targeted treatment will work on this cancer. In fact, the outcome of a bad cancer, it starts behaving like a good cancer. It's as effective as that.
Okay, so I mean, sounds like a very lay person question, I know, but let's say someone has the cancer. Are they better off if they have the HER2 or the triple negative?
I would say a HER2 probably, because the HER2 cancers have this well-researched targeted treatment,
Okay.
which has now evolved into the neoadjuvant or before surgery phase, adjuvant or after the surgery, as well as maintenance treatment. Triple negative, again, with the current evolution that's happened, with the research that has come in, we have now better treatments coming in the form of immunotherapy, in the form of platinum being used in the treatment, especially cancers which are genetic. It works very well. Platinum. So now platinum is not the jewelry that we wear.
No.
So they are the platins, the carboplatins. These are used in the chemotherapies, but they are the platinum-based chemotherapies. So these chemotherapies work excellently in triple negative breast cancer, improve the outcomes.
Okay.
And of course, then there is something called as response-based treatment. Now, the response-based is obviously, logically speaking, what you give in the before surgery period, what does the surgery report tell you, how much response, and then we based on the response, we can give a maintenance treatment after surgery for a year. And all of these have improved survival.
So maintenance treatment is what, radiation?
No. So radiation is a part of a large tumor treatment and breast conservation.
Yeah.
We're talking about systemic. When I say systemic, again, it's what you give in the oral or IV or those kind of drugs.
Okay.
The chemotherapies, hormone therapies, these are all the maintenance treatments.
Okay.
And targeted treatments. So in triple negative, we have the PARP inhibitors which have come in. These are a set of drugs specifically acting in the genetically mutated cancers, and these have also improved the outcomes and survivals.
PARP inhibitor?
Yes, they are the PARP inhibitors group of drugs. Again, very technical, very
it's a bit
too
technical.
medical for the layman to understand, but these are the new group of drugs, and you can understand that the advances in systemic treatments, that means in chemotherapies, targeted therapies, immunotherapy and PARP inhibitors have changed the whole way the cancers behave. Even the bad cancers can be controlled and can be treated well.
Okay. Yes, it is technical, but it's good to know. It's good to know the advancements in therapy. Like you said, even a bad cancer can be sort of tamed in a way.
Absolutely.
So self-breast examination, and a lump is the most common symptom. What if you can't detect a lump? Are there any other visible signs one should look out for? Changes in your skin, pigmentation, hair. What should a woman look out for?
Fortunately, I don't think the cancer ever affects the rest of the body unless you're undergoing a treatment.
Okay.
So that's why, in fact, majority of the times women with cancer with a lump go undetected and they don't talk about it. In fact, the most important thing I would say is a painless lump. 85% of the women will start with a painless lump, and majority feel since there's no pain, it's not troubling me, I don't think it's anything important. That is where the mistake happens. So remember, lumps don't lie. So if you have a lump and it's painless, you must investigate for breast cancer.
Okay.
That's one of the important things. Other factors, of course, skin changes in the breast. If there's a redness, there is a puckering, there is an orange peel appearance, it indicates it's an advanced disease. The next is, of course, nipple changes. Now, nipple retraction, nipple going in, withdrawn, indrawn nipple, or there is a flaking on the nipple, or a discharge, and especially a bloodstained discharge. These could be early signs of cancer.
What about BRCA testing? Who should do it? Let's say in my family there is, like my mother has had breast cancer, my grandmother has had. I mean, should I do BRCA test? Should I have the BRCA test
So
done?
I would probably correct that. It's not just the BRCA testing. So first of all, let's understand who needs to test. So anybody who's a young woman breast cancer, and you have understood what a young woman breast cancer is.
Yeah.
So a young woman with breast cancer, somebody with bilateral breast cancer, that means both breasts having cancer simultaneously, or in a 6 months duration develops another cancer in the other breast.
Yeah.
These are all, or even metachronous, that means after 6 months, one side cancer detected, say in a 40-year-old, and the other side comes in by a year later. These are women with a higher genetic risk.
Okay.
Third, a triple negative breast cancer or a HER2 positive breast cancer. In fact, triple negative even up to the age of 60 is considered an indication for testing for BRCA.
Okay.
I would say genetic testing, I'll correct myself there, not just BRCA. In addition to this, a male breast cancer, or if you have multiple, say one first degree relative and second degree. When I say first degree, your sister, mother, that's your first degree. The minute you go beyond, say maternal aunt, that means your mother's sister or maternal grandmother. These are second degrees. You have a first degree and a second degree relative. Last but not the least, ovarian cancer. Remember, breast cancer, ovarian cancer is the syndrome which is defined by the BRCA gene. And there are two genes, BRCA1, BRCA2. So between them, they define that BRCA gene. In addition to this, there are various other high penetrance genes which can cause breast cancer. They can be indicating breast cancer alone or a syndrome that we talked about earlier. A syndrome where there can be a prostate cancer, gastric cancer, and various other cancers which come in. So this is known as the germline mutation genes that need to be tested. One of the most important is BRCA gene of two types, 1 and 2.
Okay. And these are, just for the sake of the audience, these are tumor suppressor genes that normally help prevent cancer by repairing damaged DNA, right? So mutations in these genes increase the risk of developing certain cancers, right? That's how it is.
That's because the DNA repair capability goes off, and these damaged genes and the genes damage when you read the genetic, it could be a deletion, it could be addition, a lot of damages that happen, and the damaging factors could be environmental, could be drugs, could be various other unknown factors. When there is damage to this gene, it causes the cell not to be able to repair itself, and you have these abnormal cells that start developing. They lose control, they become autonomous, and then they become cancerous. So that's how cancers develop. And as we mentioned, the PARP inhibitors, they are the ones which help in that repair.
Let's come to environmental factors and let's come to diet. We've spoken a lot about the technical aspects. We already spoke about this rural-urban divide and how rural women are less prone to it because of their lifestyle and earlier marriage, earlier childbirth. What if a woman doesn't have children? Is she more prone to getting breast cancer?
So one of the risk factors is nulliparous, that means never had a child, never breastfed. So these two factors play a very important role. Not just that, having lesser number of children also increases the risk.
Really?
Yes, but that doesn't mean that you can tell women now that please go have 6 children because that will reduce the risk. But interestingly, a pregnancy that goes to completion, even one pregnancy that goes to completion with a healthy child being born, is a protective factor which nature has given you. Use the nature to your best capability. So if you have a child and you have a baby whom you have breastfed, you know you've taken that first step towards protecting yourself.
Okay, but why? Why is it so? If you can explain the science of this.
Because there is a hormonal influence. You see, all that we have spoken about, a lot of the things are indicating there's a hormonal influence in breast cancer risk. And that hormonal influence is when there is, I'll have to really get into technicals here.
Estrogen.
Yes, the estrogen hormone and progesterone hormone. So there's always that every menstrual cycle has an estrogen surge followed by ovulation mid-cycle. That means when the ovary releases the egg or the ovum, and followed by an increase in the progesterone levels. So when there is an unopposed estrogen activity, that means you're having anovulatory cycles where the ovum doesn't get released, you do get a higher risk. And these anovulatory cycles are very common in very young and very old. Okay. Not only that, if there is pregnancy, there's a huge amount of progesterone that's produced by the placenta, which helps you to retain a pregnancy. That progesterone is also protective. But that doesn't mean that you can take exogenous hormones and protect yourself by just popping in an estrogen or a progesterone.
Or hormone therapy or something. No.
So in fact, hormone replacement therapy, which came in for for women who stop periods and whose periods have stopped because they're menopause, that hormone replacement therapy has been implicated in higher risk for breast cancer.
Okay.
So the exogenous hormones don't replace the endogenous hormones.
Okay, so HRT is not advisable if you have a family history of cancer, because that's what people tell me, that don't do HRT because in your family there's a history of cancer. So don't ever go in for HRT. It's good that you clarify these things because they're important to know. What if a woman has early menopause? Does that increase the risk of cancer?
In fact, a late menopause is a risk for breast cancer.
Okay.
So the longer duration of exposure of breast to the estrogen and progesterone hormones with an early menarche and a late menopause is known to be a risk factor for increasing breast cancer.
Slightly confusing for a non-medical
Right.
person, but good you clarify that. Now to the lifestyle. ICMR recently came out with a study about how the Indian diet is, leads to many health risks, particularly metabolic diseases like diabetes and obesity and things like that. But this is this carb heavy Indian diet, because their study reveals that more than 62% of daily calories in the average Indian diet come from low quality carbohydrates such as white rice, milled wheat, added sugars. So they're talking about metabolic disease. But does this kind of carb heavy diet also lead to greater risk of cancer or refined carbs?
A good question, a good point you brought out, because it's not a direct relationship. So all of these high carb diets and poor carbs that are taken in increase the risk of obesity.
Yeah.
It is obesity that causes higher risk for breast cancer. Secondly, there's also the diabetes that comes in along with it, and insulin resistance. All of these play a risk in increasing the risk for breast cancer. That is where the dietary part comes in. So a good diet, a healthy diet, a fiber-rich diet, all of these will reduce the risk by reducing obesity.
Yeah.
Of course, any other factor, any other lifestyle practice, for example, exercises, for example, being very physically active, can reduce your risk for breast cancer.
Okay.
So they're all there. It's very easy. It's all there for you to mix and take and absorb into your life, and you can actually bring down the risks that you may carry because of other reasons.
Okay, so this carb heavy or refined carb heavy diet does increase the risk indirectly because it leads to obesity, and obesity creates a tumor promoting environment through chronic inflammation. That's how it essentially works, and high insulin levels.
I would say there's another thing. It's not just the chronic inflammation. So obesity in women, and especially postmenopausal, the fat under the skin is the source of estrogen.
The visceral fat.
Visceral fat is the source of estrogen for women, where the ovaries have stopped working. We did say that hormonal influence is very strong when it comes to risk factor for breast cancer. But what about postmenopausal women? They do seem to be showing a higher trend. In fact, the annual increase in incidence is higher in postmenopausal than in premenopausal.
Oh.
And especially obese postmenopausal women are at very high risk for developing breast cancer.
So postmenopausal women with visceral fat have a higher risk, but at the same time, late menopause carries a higher risk than early menopause.
Yes, they don't overlap.
Yeah.
The reasons are different.
The reasons are different.
Yeah.
Okay. So, but how do you replace the Indian diet in general? Okay, but otherwise the Indian diet, they say, can be quite balanced, right? I mean, otherwise how should you move towards a Western diet? Because then there are studies that show a Western diet is worse.
No. So
meat, too much processed food. So what kind of diet should you have?
So in fact, I would say that the Indian diet is better as compared to the Western diet. If you look at the overall spread that we normally have, it's a very balanced diet. The problem comes in extremes, over anything in moderation is always good, anything in extreme is not good.
Yeah.
So if there's an imbalanced, like tilting towards too much of carbs, that would not be good. Too much of oils, they're not good. So you do see that, everything has to be a balanced diet, and that is where the answer lies. As far as the meat is concerned, red meat is probably more harmful.
Okay.
But things like, fish or, chicken, these for those who have non-vegetarian would be probably a better choice than to have a red meat.
Okay.
So there is a balance you can get in both kinds of diet. It's not like you have to really restrict yourself to a vegan diet and that's what is going to take the cancer away. It's not like that. It's a matter of balancing your diet so to have the right proportions of everything.
Okay, so it's about balanced diet. It's not about Indian versus Western. Alcohol, not at all, or limited doses is okay?
I think lifestyles and even socializing and having a little bit of alcohol is slowly getting into being a norm even for women in India too.
Yeah.
And this is where the urbanization comes in. You don't find this so much in the rural areas. Alcohol, smoking have been implicated in a majority of cancers. So one does have to play safe.
Last couple of questions. What's the biggest myth about breast cancer? You hear all sorts of things about underwired bras and wearing black and like larger breasts being more prone.
I would say that media has played a major role in bringing these myths out. Otherwise, I wouldn't, we wouldn't discuss about it. But these don't have any background. So there is no color that increases your risk for breast cancer. We didn't discuss that all throughout now. So no red bras, no black bras will ever increase your risk. Underwired bras, you're comfortable, please use them. It doesn't cause any increases. The use of DO does not increase the risk for breast cancer. What else?
Larger breasts?
Larger breasts. There have been certain evidence, in fact, that larger breast tissue, so dense breasts, okay, dense breasts that seen in the younger women, more the glandular tissue, higher the risk. That correlation has been seen. Okay. But the usual obese larger women have more of fat than breast tissue. So it's not that matters. What matters really is how much of dense breast tissue is there.
Okay, Dr. Parmar, very fascinating conversation, very important, but can you leave us with one message? It is Breast Cancer Awareness Month. Of course, there should be awareness every month of the year, but if you could leave the women of India with one message and some guidelines.
Yeah. So I think October is the Breast Cancer Awareness Month, but October is when the awareness starts. It doesn't happen only in the month of October. I would say that early detection is the key to cure. If you are breast aware, self aware, check yourself every month, once a month. Ensure that if you find a lump, and especially a painless lump, present to your doctor early. Do get yourself checked, clinical breast examination by a doctor, by a gynecologist, but get it done every 6 months and you will be better off because you will detect the cancer early if at all. And even if detected early, you will realize that you will be able to get away with a lesser surgery, less of toxic treatments, and you will do much better. So be breast aware, take care of yourself.
Okay, thank you, Dr. Vani Parmar. Excellent discussion, very helpful. Every week on Buzz by the Bay, we bring you experts from different fields. So subscribe to the Free Press Journal YouTube channel and press the bell icon so you do not miss the latest interview.